Okay, good morning, everyone. Hopefully, you're having a great Tuesday morning. I'm Dr. Jess Daigle. I'm a board certified pediatrician and NICU hospitalist and founder of Mom and Me by Jess Daigle MD, which is an upcoming in-home and virtual fourth trimester postpartum care service designed for moms and their little new babies to help ease the transition from home after delivery. And so this became important to me because moms and babies go through a lot, and it's a lot of struggle in those first few months as you're trying to adjust to recovering yourself and also taking care of a new little person. And as you know, if you're not a first time mom, life does not change just because you have a new little baby. You're often just trying to reframe your life and make it work for you. And so along with that, I've come to learn a lot about what the needs are for moms. And me as a mom myself, I've started to think more about my parenting, which is something that you start to become concerned about when you have a new little person. You realize that responsibility is huge. And you start thinking about, well, what kind of person am I? And what kind of person I want to be as a woman and mom, and how that impacts my children. And so as I've been on this journey, I've come to learn about mindfulness and meditation, which are not things that I believe I actively practiced before and really had no awareness of. And so, but I've started to learn a little bit, and I'm thinking, I think this can help moms as they're at home with their new little ones and are beginning their motherhood journey. And so here to talk about that today is my friend, such a wonderful person, Dr. Rashmi Schramm, who is a board certified family medicine physician, a certified coach, and also a meditation teacher. So we're going to introduce her and let her kind of help us moms figure out how we can be the best version of ourselves for us and our little ones. So thank you, Dr. Schramm.
Thank you so much for having me, Dr. Daigle. This is my absolute pleasure.
Yes, good. So tell us who you are and how did you get into mindfulness and meditation? And then what is mindfulness?
Yeah, for sure. So as you said, I'm a family practice doctor. I'm also a coach. I'm the founder of Optimal Wellness, and this is where we bring in meditation as well as coaching. And I help busy moms to ditch guilt and to tap into inner peace and power so they can live more energetic and purposeful lives. So the way I came to it was really because I needed a lot of this myself. And so my kids are now 17 and 15. So this has been a long journey, but when they were little, I found myself really frazzled, really overwhelmed, and not understanding how to deal with the stressors that come with working and being in complex relationships and being a mom. And so really, I started to experience insomnia. I started to have a lot of anxiety. I felt overwhelmed most of the time. And yet to the outside, I looked just fine. I started to have daily migraines. And I wasn't tolerating any medications. And so I had had exposure to meditation as a child, not that I meditated as a child, but I grew up in India. And I also then had relearned how to meditate in college and forgot all about it during med school. So I actually was like, wait a minute, I think this could help. And so I started to dabble in it a little bit several years ago, about 10 years ago, and it would help my migraines. I would sleep better. I would feel better. And then I'd forget about it for another few months, and then I'd get really bad again. And so it was like this crisis meditator for a few years until about 5 or 6 years ago. And I was just like, wait a minute, this is silly. Let me just double down. And so when I really committed to a consistent meditation practice, a lot of things shifted for me. Nothing in the outside shifted, but everything on the inside shifted for me. And it made such a big difference for me that I had to go back and really learn how to be able to teach it. Because a lot of people were asking me to teach it. I was teaching it, but I was like, I kind of I want certificates. So that's how I became a meditation teacher. And, with coaching, they're just like yin and yang. They just go so well together. So that's really my passion.
Wow, you have said this is like I've done a lot of lives. This is like one of my favorites. I love the rest of you, but this is because you are like speaking to my people. Like it is overwhelming being home because oftentimes, like you point out, you're already living a life that you're existing in. And you're still oftentimes, if we're honest, we're always still trying to frame what that life's supposed to look like, what's really making us happy before we had kids and in our job or with our spouse or significant other. And so then you add in a baby, it's another layer of responsibility because that weighs on you because you're like, wait, this is a person that I have to grow up, and like everything I do influences them. Like that became so heavy for me, like personally. I mean, I love the challenge of it too, because I think, wow, I was also look at it like that's exciting too. Like, wow, what a huge gift. But with gifts and like we know with other things comes responsibility. And so you've basically outlined like this is real time. Like you will have this overwhelm and there will be anxious moments. But my goal is for my families not to stay stuck there. We should always be finding a way to be our best self and in a best place, because life will bring those moments. And if we succumb to it, we will never really come from under it, actually, because something will happen today, and then something will happen tonight, and then something will happen in the morning. And it's like every day something can come your way. But if you have tools that you can say, you know what, yes, this has happened, but I actually have the power, like you said, that inner peace and power to either say, okay, this has happened. I can't control that, but I can control how I move forward. That is so much more empowering, right? Than like a place of defeat, like, oh, this happened to me, and then succumbing to it. So what exactly is mindfulness?
Yeah, so I love this whole discussion. So mindfulness is really, really, really simple. So it is the awareness that arises when we are paying attention to this present moment without judgment and with curiosity. Right. So we don't actually have to learn how to be this way. So if you've got young kids, like mine are older, but young kids are already always mindful. They're always in this moment. They are always curious and they're not judging. And so this is our innate nature. And so I think one of the most beautiful things about having babies and little ones is we get to learn mindfulness from them actually,
Wow.
and really just being in the moment. And their innate state, unless they're hungry or tired or whatever, is joy. Like you don't have to, like, what's going to make my baby happy? Actually, the baby is already happy.
Yeah, they're just like looking around and just, yeah, you're right. They really are in the moment. I have said that when I'm rounding at the hospital, like they're just living their best life.
They're living their best life. I've got, I've got the most amazing. Yeah. So we have the best teachers ever right here with us when the little ones are little. And so our job, especially during that fourth trimester, like you said, I mean, there's just a lot of shifts that happen, right? Like you're bringing home this little bundle, this human being, and you don't know anything about how to take care of them. I mean, me as a physician, I was just like, oh my God, do not leave me alone with this creature. Like, oh my God. And I mean, I was overwhelmed, 12 out of 10. And I like my friends still joke about it, but I thought I had to be teaching her something like my 17-year-old all the time. So I was like reading her books when she was like a week old. I was like telling her the ABCs, like, like it's weird how we're like, oh my God, is she gonna?
We're like so far ahead.
Yeah. So there's just a lot of this weird self-induced pressure that can happen for ourselves, not to mention the physical pressures, right? Like, I mean, our hormones are all over the place. The baby is very needy. This is the fourth trimester. Like they still need us more than they needed us during the third trimester, except now they're outside of our bodies. And we kind of want our own bodies back, but we can't have it. So you're trying to learn how to breastfeed. You don't know how to breastfeed. You don't know if you're eating the right things. I mean, there's all these different things, which is why I think somebody like you, and I joked about this. I was like, oh my gosh, Dr. Daigle, I wish you were around when I had mine. And you were like, well, I was in 5th grade or something. So I was like, fine, I guess you couldn't help it. So mindfulness can help us in ways that can just bring us back to the present moment, right? Because most of the time when we are stressed, we are predicting the future. We are predicting a catastrophe happening in the future, or we're really ruminating about something in the past. So when we bring in mindfulness, and it can be really, really, really simple. And I would say, during the 4th trimester I don't think it's a great practical time to learn how to meditate, for example. Yeah. If you're already a meditator, awesome, spend 5 minutes meditating, but it's not a period of time. Like right now I work with moms who have kids who are a little bit older, or maybe even out of the house, and they have a little bit more time. And so they can dedicate 20 minutes at a time. They can dedicate 30 minutes at a time, right? So that's a different meditation experience. Whereas with, when you've got a newborn, when you've got maybe a toddler and a newborn, then really it's just this idea of bringing yourself back into the present moment. And the fastest and most effective way to do that is with your breath. The breath is always right here, right now, right? And so that's really how because I've had, moms who have young kids, and that's really where we start. And it's the simplest place to start. And it's an incredibly powerful place to start. And you can just practice just simple belly breathing. And you can just do counted breath, right? So you can do 4-4, like the box breathing. You can do counted breath, especially if you've got a screaming baby and you just need 1 second of peace, of grounding, because we can really get carried away. And so when we need that grounding, we can just come right back to the breath. And so that, I think, during that 4th trimester and even beyond, even when the babies are babies, there's probably not enough time to just sit down and do a formal meditation practice, is what I would say.
Okay.
So you can do a walking mindfulness, right? Like that's incredible. You can just go outside and, reconnect with nature. Just take 10 minutes to do that. And if we go without our, devices, then that's even better, right? Because then you're starting to notice, you're noticing, what does the sky look like? What am I hearing? What am I smelling? How are my feet feeling? Just noticing those things can bring us into the present moment, which then is it's actually the only thing we have anyway, is the present moment. We think we have all this time, but no one knows.
Yeah, that's true. So I was going to challenge you. Said like we shouldn't be interested in meditating, but for someone like me, I'm telling my moms to find, like, I'm a proponent of self-care too, and that finding that time and balancing with asking for help. So could you possibly do, well, then that would mean there's 2 things, like what is the definition of meditating? Because for me, like in the morning, like this morning I got up, and my youngest child is 3, but I got up at like 5 a.m. and I just took time to like pray, and I read through I do like a plan that kind of talks about some different things and kind of lets you ponder, like life and different things like that. And so I took like time to do that, which I feel for me is part of a grounding. Like I would have considered that like a type of meditation. So is there a way to kind of do a little bit of something in that form of that in terms of self-care? Or are you saying that even just practicing, just being mindful first is even a form of self-care, and you don't have to make it like a huge 20-minute thing, but there's something 5 or 10 minutes you can do? So sorry, it's a loaded question, but just trying to frame it like what is kind of lends to what is the real definition then of a meditation, right? Because then somebody might be like, well, I spend like 10 minutes doing something in the mornings, and for them that might be their meditation practice. So what's your answer to that? I guess
for sure. And I love how you approach that, because right, it's actually not a one size fits all. And so meditation is also a really simple definition. It is a formal way to practice mindfulness, and it is literally going from activity into stillness. And so, there are several different kinds of meditation. So you can, and they're all valid. So there's breath meditation, there's guided meditation, there's mantra meditation, and I teach the guided meditation, I teach the mantra, I also teach the breath meditation as well. And so there's not like one that's superior to the other. It really, I say, try it out. It's an experiential thing, right? So if you happen to have help and you have 45 minutes, goodness, yes, spend 10, 15, 20 minutes meditating, because that actually is going to strengthen your mindfulness muscle and release a lot of this unhelpful stress. And eventually, when you do get time to sleep, you'll have the ability to be able to fall asleep faster, optimize your sleep, all of that stuff. So it's not to say you shouldn't meditate during the 4th trimester, but there's so much to get used to. I worry about saying, here, learn this new skill. And so, which is why I said, if they're already meditating, keep doing that. If you're just looking at, okay, how can I bring in mindfulness? Number 1, learn from the baby. Number 2, have that self-compassion, right? Like we're going to make mistakes as moms. Like I make mistakes every single day as a mom, and that's okay. It's because I'm doing my best. I'm a human being. And so, when we bring in that self-compassion, that makes a huge difference. And then try things out. So, what I think is brilliant is for you wake up earlier, you're doing journaling, you're doing your prayer, and that is what is grounding for you, which is brilliant, right? So we can always experiment and we can say, well, this is what works for me. I agree. I do something very similar in the mornings as well. But if somebody had said, wake up earlier, like, when my baby was like 2 months old, I
Yeah,
would
no,
have been like, you're out of your mind. And so this is a lot about me feeling like, let me meet you where you are.
you are. Love
You
that.
know? And
Yeah.
so instead of being like, you have to do this, like I like to say, hey, here are some options. They work really, really well. And ultimately, the whole goal is for you to thrive through this really challenging experience and not just feel like you're surviving. Because I can tell you, even with, even the second time around, I was just like, I just got to get through. I just got to get through. Like, and
Yeah.
I wish that I had a different attitude. I wish that I had been like, oh wow, they'll never be 10 days old again, and I really have to really savor it. I mean, maybe there were moments of clarity like that for me, but the vast majority of the time I really felt like I was not doing something I was supposed to be doing. And so when I can bring in just that, this is enough, I am complete, this baby just needs for me to be peaceful right now, I would have a different experience.
I love that. And that is what my goal is too, because I have seen in some moms groups, Rashmi, that they have that regret, like of, man, I don't even remember like my baby being 5 and 6 months and stuff. And that weighs, right? So then you got that guilt and weight that you feel from that. And so I feel like if we can get ahead of that and say, hey, like what we talked about, and I think you kind of helped me coin this term, that normalize and strategize, like normalizing, yeah, this is what will happen because of all these challenges. It's kind of just like breathing, like it will happen, And so, but what can you do to maximize things, knowing that there are things you can do? Because a lot of it is awareness that these stressors are come, but there are tools you can use, and that you always have the power. I love that, what you're saying about that inner peace of power. We have the power to pivot and change. And I don't think we do enough to promote that as individuals, like to realize that nothing is set in stone. I mean, the basic needs of like eating and sleeping and being clothed just for society's sake and your own health, right? If you can get that done, everything else really is imposed on us. Like, this is what you need to be doing to be looking successful. And this is what you need to do to say you're a good mom. And this is what and I'm trying to move away from that should and all of that. Yes, there are basic things to do because that's just inherent to survival. Like if you don't eat, you're not going to continue to live. Like that's just simple stuff, right? But outside of that, what is it that your own body is telling you? What is it that your own spirit is telling you? And mixing that in with where, the impact you want to make in life, then kind of building out your life. Like we're all changing, and the person you were when you were 5 is different from the person you were when you were 15. And it's the same thing. Like when you're having a baby, that's different too. And it's just relishing those different, approaching it, like you said, from curiosity, like, wow. And so you actually, while you were talking, gave me an idea of maybe creating some type of journal or something, or encouraging people like to have something like every day, maybe take a few minutes to jot down your thoughts about it, and or keep a thing for yourself about your baby, like, ooh, today they giggled for the first time. And that way you can look back and say, oh, that is when they did that, or I did remember that they, took their first step on this day, or whatever, and that can bring some joy too. So one of the other things, well, you kind of already went through some of the what is mindfulness and then how can it help them. And I love that about the baby really showing you, like for my example today, maybe you could use my example. So, I was getting ready to do this live and I'm at home with my daughter trying to get ready. And she's like, she see me putting on my shoes. And so she's like, Mom, I got my shoes on, and she got her tablet and she thinks she's coming with me. And I'm like, no, Avery, I'm going to come back and get you because I know she's going to make noise while we're doing this. And while we are a little bit more lenient nowadays in this virtual world and post-COVID, people are not afraid to see your toddler popping up in the window now. But I wanted us to be able to do a good talk, to focus and help people. And so in that circumstance, what would have been your advice to me as a mom, like dealing with that struggle of my toddler wanting one thing, and I know what I'm trying to also accomplish?
Yeah, that's always the trouble, right? Is like, and what is there a right answer? Absolutely not. And so, like, when you know that, well, I mean, you are the boss, like, you're not the boss of her, but you're the boss of the situation. And you know that you have certain obligations that you've committed to. And so sometimes it is just about not necessarily being stern, but just firm and just, being kind, gentle, firm. And then modeling like that compassion for her immediately afterwards. Because what she really wants is your time, right? Like she doesn't want anything else. She just wants your attention. And that is the highest form of love we can give anyone.
I
And
agree.
so it is our full attention. And so that is how you give love to her. And so that's what she's looking for.
Yeah.
And so as soon as we're done, I'm sure you've probably got some
Yep.
time set aside, and, and not to be on your phone, not to be on any,
Yep.
on a call or something, just to be with her. And so that is, there's always that push and pull, right? As a working mom, there's no right answer. And so sometimes it's also okay to cancel work and be with her too. Like,
I agree.
right. So it's like, there's no right or wrong. It's just, you got to just trust your gut.
Yeah.
Yeah. Yeah. And then, there's always mom guilt. And so the idea isn't that we have to have mom guilt. We really can allow it to go a little bit because it's not serving us. And so the whole time they're watching how we're moving through life. Sure. And that's actually becomes really, really important. They're watching everything we say, everything we do, everything we put in our mouths, who we talk to, how we spend our time. They're watching all of that. And so you're going to be modeling that for them. And so if you model, I can be this grounded individual. I am your mom. This is my priority. But, I also have these people to serve as a physician, as a coach. And so I'm going to take this time, Avery. And as soon as I come back, we're going to have this time together. So, and it sounds like that's exactly what you did.
Words. Yeah. And so I have learned to do that. And that's where I wanted to have this talk, because I've learned to understand that. I was participating in this Parenting with Peace talk, and it was so good. And it was talking about that, what are we doing and what they are, like how a baby crying, that's their language, that's the way they're expressing. So we don't think, we might get frustrated because you don't want them to cry because you really just think you want to fix the problem. And I think that's where it comes from, right? Like, oh, that means something's wrong, I need to fix something, right? But we don't typically get mad at that. We understand that that's how they communicate. So I've started to understand that with her. When she's frustrated, I acknowledge it. I say, Avery, I know you're frustrated that I have to leave right now. I get it, but I'm going to have to come back. I'm going to come back so we can do whatever. And then she's like, now she's gotten good at it too. She says, okay, and it's always so sweet. And she went and sat down, on the couch with my aunt or whatever. And so you're right. So then she's going to have that pattern of, well, my mom told me that she was going to, and so when she sees me doing it, she's going to also have that remembrance that I kept my word. So I kind of that was a good scenario to show our moms that there are always situations and there always that tug. And you're right, there really is no right answer, in the form of, you do have to sometimes do things and make some choices, but you can't approach it in a positive way. Like, instead of me yelling at her, like, I have to go, and you just got to understand. Well, she doesn't understand because she sees me and she's like, well, why can't it happen now? They don't have that sense of time, and that people have responsibilities, because you're right, they're in the moment, they're mindful of where they are right now.
Isn't that beautiful? Yeah. I remember when my babies were little, I remember just literally sobbing, crying, going to work, out of control crying. And so it's okay. We have really tough feelings. It's the priorities, they're always competing. And they're always evolving too. Now my teenagers, literally, they don't want to hang out with us. They don't want to hang out with me. And that's fine, right? That's the mark of now my job is to get out of their way and let them
be that peripheral support.
Exactly. Let them discover who they are. Let them really start to evolve and expand into the beautiful, amazing beings that they are. And that's another interesting way to parent too, is that for a teenager.
Yeah, I love that. And I'm, I bought this positive parenting course that I'm going to go through. Cause like I said, this is not even, I was a pediatrician before I had kids, but this type of stuff wasn't on my radar, because I was, you only can know what you've experienced, right? I say they're the 3 E's: education, exposure, and experience. So, depending on in which phase of those things you are, it's going to determine how you do things, right? Once you learn something else, then you tend to shift what you do. We do that as physicians, okay, well, we're no longer doing that. Okay, sorry, we don't do that anymore. Now this is the treatment, or this is the whatever. So we're always evolving and having to take in information and kind of make decisions. And that's one of the things I'm going to get across to my parents in my webinar this week, or my workshop, I should say, this week on the postpartum planning. That's one of the things that I'm going to talk about too, is planning is good, but always be mindful and flexible that we don't know everything that lies ahead. And so you serve yourself well by practicing self-compassion and grace and being flexible as a parent. I think if you can achieve those three things, you really will thrive, because you will be more mindful, and then that serves us all better.
For sure. It keeps us like being able to enjoy life rather than just feel like you're just being dragged along.
Striving for something. And then like that whole arrival fallacy, which is what we've seen happens just with most things in life. You're always trying to get somewhere, and then you get there and realize, well, that's not what it was all cracked out to be. But you know what? I enjoyed the journey. I've even taken that with trips, like you think, oh, we're going to go to this beach and do this. And you get there, you're like, I mean, it was okay. And so then, but what made it good was being there with my kids, being there with my husband, them throwing sand in each other or laughing or chasing each other. Those are the things that actually bring us joy. Not that it was the beach or the water, but the people that we were with. So that's really good. So you really touched on all of the things that we were going to talk about, like what is mindfulness, what is meditation, how they kind of work together, and about like, starting with mindfulness, and then that can always evolve and extend into longer meditation practices. But if we're at least always mindful, we're already positioning ourselves to be in a place of having more peace and power, because we always have that opportunity to pivot and change and do whatever we need to make our lives better. So, absolutely. Wow, I love this.
I do too.
I just already see so many moms' lives going better already. And so before I let you go, what is one other piece of advice? Is there any other piece of advice you have other than practicing mindfulness for new moms, or that pretty much is like the biggest piece of advice that you have?
Well, there's so much advice. I mean, it's been so long, obviously, since I had a fourth trimester, situation, but I do have patients. I have clients who are, who have little kids. And a lot of it is just this beating ourselves up. I see that a lot. I see a lot of the inner critic come out pretty severely when we are new moms, because, there's so much expectation on us as in society. We're always supposed to be put together. You're supposed to, have like the baby put together. Baby's never supposed to be crying. You're never supposed to lose your cool, all that stuff. Like, the thing is, like, to feel the feelings and to understand that the inner critic is really from societal conditioning, and to bring in that self-compassion and notice, like, you said the magic word to me, which is awareness, and being aware of this feels hard because it is hard. It's hard because it's hard. And so to really bring in that self-compassion, that would be a game changer in any situation, particularly in the fourth, fifth, whatever trimester that we're talking about. But having a little one and being able to have compassion for yourself is, I think, the key. So I would say that's my takeaway.
Good. I love that. And that's what my mission is. And I kind of borrowed that from you, that ditch overwhelm. I was like, oh, I need to steal that from Rashmi. So, because I am on this mission too, to help moms ditch overwhelm, feel competent in their life as moms and reconnect with themselves, because that's something I've seen too, where people feel like, oh, now that I'm a mom, well, no, you're still the woman as well. It's all roles, to be honest. Like, just like when you're at work, you have a purpose there. When you as a woman, you have goals. You as a mom, you have goals. And it's that interconnection and approaching it from curiosity and a place of love, right? When you operate from a place of love and appreciation for yourself, then it's already understood that you're not going to be perfect. Like, that's the other thing, like these unrealistic expectations of ourselves. You're right, which comes from society. I said I was going to write a book called Who Said, because like sometimes we were really going hard on some stuff and then we don't even know where it came from. Like, and then you like find out like it was some Joe Blow down the street, like who's not even doing what they told you to do. It's like, you don't even do what you said.
Yep.
Like, so I tell parents, like when it comes like the safe sleep, I tell them about safe sleep. I say, when you're breastfeeding, will you fall asleep breastfeeding your baby? You will. I'm not even going to judge you for that. The thing is, like, what did I do? And I put a timer on my phone. My husband was my accountability partner. Hey, you're falling asleep over there. We don't want to drop the baby. So see, I put a thing in place. I knew that it was possible. I didn't feel bad. I'm tired. Yes, I'm going to fall asleep. At some point, you're feeding a baby around the clock. And it's not just one day, it's every day for months, forever.
Yeah.
So,
Yeah. It's a long time.
yeah, that's a long time. Like any other job, if you look at it, like even when we were on call as residents, we knew eventually we were going to get to go home and go to sleep, depending on your circumstance. Like some people had kids in residency too, so they're a little bit different. But in general, you knew there was a finite amount of time and then you were able to do some kind of recovery. When you have a kid, unless you have the help of somebody doing other things, you are really the one that's on. And so that's why it is important to be able to ask for help, understanding that that's actually a sign of strength, because you can't do everything at the same time. That's false expectation of anybody. Nobody can be
Absolutely. Absolutely.
Nobody can be everything for anybody. Nobody.
That's right. That's right.
No. So we're gonna let moms let that go.
Exactly.
You have me and Rashmi's permission.
That's right. 100%. Yes.
Yeah. So tell people how they can find you, and also look at some of your stuff, like your other talks you might have done about mindfulness, or even like the different meditations you mentioned. Like if they're interested in just learning or seeing what that looks like, how can they see that from you?
So my website is optimalwellnessmd.org. Okay. And so I will almost always, if anybody's interested, I'm almost always have different, entry level packages into meditations that also give you support. So I've got one that's coming up now because I always have those. I also have free ones that are pretty popular on YouTube. And so you would just go to YouTube and Google my name, and they're all free. And so there are evidence-based, meditations that are, 5 minutes, 7 minutes, 8 minutes. So that's always a really good place to start. And then, I'm on Facebook, I'm on Instagram, and it's really just my name. So I would love to connect with anybody who's interested.
Yes. So I'll put all that. I usually go back after these and I'll edit and add in underneath there to add all the extra links. So people are have that in a central place. And if you want this video, I can always send it to you too via email. You have freedom to use it however you want. So this has been such a good, I love you.
I love you back.
And I'm just so happy. I feel joy and knowing that we just get each other, and that this is important for our families and just people in period. I mean, I focus on moms, but it's good for the dads too. Dads, you can be mindful and meditate too, and figure out that way your family unit thrives.
That's it. That's
the beauty of it. Everybody can practice mindfulness and have meditation and periods where they come to themselves and figure out how to be their best self and thrive. So thank you so much, Dr. Schramm, for being here today. I hope you have a lovely Tuesday. And for those of you, I think it might be coming up to a window. I think you have until 12 or 1 o'clock to still register for my Developing Your Postpartum Plan workshop. It is going to be so good. I'm so excited. Even if nobody show up, I'm still going to be on there talking.
Oh, it's going to be fantastic. I bet it's going to be jam-packed. I would be there in a heartbeat.
Yes, I just love it because my mission, even at the hospital, when I see moms laugh, when I joke with them about hey, tuck in, you think this first sneeze or something, wait till you got to go to the ER, they have to have surgery, or, it's just letting them know not to downplay it, but we're walking out this life. Everybody, we're on the journey of discovery. The baby's on the journey of discovery. They're trying to just do their best too. Everybody's just trying to be who they are and try to get to a better place of themselves. And so if you participate, you're going to come away with a good idea for yourself of some resources and some things that can help you thrive at home with your new baby, because you're not supposed to do it alone. Okay. Nobody, I'm against that message of doing it alone. This whole thing that women have to do it all to be powerful is a male society narrative. Okay. And I'm here to smash it.
Smash it good, Doc.
Yeah, I'm gonna smash it good. So anyway, you go and have a great day, and I'll see you in EBS.
You got it. Thank you so much, Dr. Daigle.
All right, bye, you guys. Hope you enjoy.
Bye.